A major milestone in the cyclospora outbreak. Michigan now confirmed more than 10,000 cases of the foodborne illness. Our Dr. Nandy joins us live with a closer look at new data showing that cases may have peaked here in Michigan. Doc.
Yeah, there's several encouraging signs, Glenda. First, state health officials say the recent jump in numbers doesn't necessarily mean a surge in new cases. And about 475 of the cases added since Friday, Glenda, were actually delayed lab reports that were only just reported. So, we're seeing fewer emergency department visits as well for diarrhea, one of the main symptoms of cyclospora. Another encouraging sign is that lab positivity rates, well, they're beginning to fall. And that means a smaller percentage of folks being tested are actually coming back positive. Now, none of this means that the outbreak is completely over. In fact, some Michigan hospitals have been limiting testing with more than 10,000 cases and 160 people hospitalized. This has been one of the largest cyclospora outbreaks in Michigan that we've ever seen. So some health systems not only have a backlog of cases, but are also running out of testing supplies. Because of that, they've limited testing to patients who are very sick or have weakened immune systems. So many of the milder cases may not be getting tested or counted. That said, I think these trends are encouraging and suggest that we may be finally turning a corner.
Okay. So do you expect to start seeing cases go down then nationwide, and should people still be careful?
I think it's possible, Glenn, that we'll see a national decline in the coming weeks. Since the largest outbreak is linked to contaminated lettuce, it should gradually work its way out of the food supply since lettuce has such a short shelf life. That said, health officials are still investigating several other outbreaks around the country. They may involve different foods like cilantro and parsley, and other possibilities that contaminated irrigation or processing water may be involved. If that's the case, it can continue to spread the parasite to new crops and new batches of produce. We unfortunately still have a lot of unanswered questions. In the meantime, though, folks, residents should continue to wash fresh produce under running water, remove the outer leaves of the lettuce when possible, and cook when appropriate. And remember, if you develop persistent diarrhea, please don't ignore it. Reach out to your doctor because we can treat cyclospora very easily with the right antibiotic.
All right, Dr. Nandy, thank you for the update.
Hey, my pleasure.
If you have a question for the good doctor, you can email him, Dr. Nandy, at askdrnandy.com, or you can send it to us on Facebook.